Hi, Rich Fitzgerald, County Executive here. I'm going to be joined by Dr. Deborah Bogan, Director of the Health Department, and Matt Brown, Chief of Emergency Services, to make some announcements today. As was stated earlier, we're confirming that the first death attributed to COVID-19 has occurred. First of all, our thoughts and our prayers and sympathy goes out to the family. What we will say about this is an individual that is in their late 60s, and other than that, the family has asked us not to provide any other information, and we're going to respect their wishes. And again, our sympathies to the family goes out. While we've been saying that this is a serious health issue, the efforts that the community has undertaken over the last week or so has really been helping. Epidemiologists have been saying that 80% of those testing positive will be able to stay at home, while 15 to 20% will need hospital care, and that 5% of those will need acute care, and potentially nationally we've seen that 1% of those folks will not survive. And as we have said, our medical professionals, Dr. Bogan and her team, and all the healthcare professionals we have throughout this region are working diligently to continue the treatment and improve upon those numbers. I wanted to put out just something that the CDC has released to kind of put things in a little bit of contextual perspective of the rates that have happened as far as survival rates. We know that worldwide, those over the age of 85, 10 to 27% of those have not survived. So that's why we say it is so important for our seniors to be protected and be away from people. People in the ages 65 to 84, 3 to 11%, 55 to 64, 1 to 3%, 20 to 54, less than 1%, and under the age of 19, there have been near 0%. So we want to just put this in perspective. So for a lot of our young children that are out there, we certainly want you to be protected and take care, but we don't want you to be unduly scared during this time. Again, what I will say is during this whole time that we've announced this over a week ago with Dr. Bogan and her team, the support and the work that the community has been doing, people staying home, people keeping contact away, the 6-foot contact, not working and coming in contact with other people has been very, very helpful. There's two things that we do want to say, and Dr. Bogan's going to get up and talk a little bit more in more detail on some of the testing numbers, and then Matt Brown is going to get up and talk about some of the personal protection equipment that has been out there in the news. We're going to talk about how you can make let us know that there could be some donations, how the folks that are in need, our first responders who've been working with our emergency services on how those can happen. I'm going to give an email address out there where people can send emails to us to let us know that they might have some materials, whether it's the N95 masks or other materials. We will be making announcements in the coming days as to how that can happen. As of now, don't be donating anything, don't be bringing anything, but send us an email because we want to make sure we don't get overwhelmed with some things that might not be usable. But let me give you this email address that people can start sending to. It's COVID-19, COVID-19, donations, DONATIONS, at AlleghenyCounty.us. I'll give that again a little bit later, but we want to make sure that people have that and can send us emails, and we can start to gather some of that material that I know many of our construction companies, many of our building trades, and others who've come forward, and other organizations offering to make those announcements. But let me right now ask Dr. Bogan to come up and give an update on some of the things that the information that she has. Dr. Bogan?
Thank you, County Executive. First, I'd like to extend my sincere condolences to the family whose loved one passed away today from COVID-19 in our communities. As we reported earlier today, we have 31 individuals who have tested positive for COVID-19 in our county, and this number will certainly increase in the coming days, in part because we're now increasing testing, but also because we have community spread in our region. As we have emphasized over the past week to 10 days, the most important thing we can all do to stop the spread of the virus in our community is to stay home and practice social distancing. We know that it may not feel like this is being effective because we're seeing an increase in our numbers, but there's a lag of 5 to 10 days, so we're always looking ahead, right? So you want to be knowing that what you are doing is effective, and this is really the only and the most important, not the only, but the most important thing we can all do at this time. Again, remember to practice good hygiene overall, wash your hands often using the proper techniques, cover your coughs and sneezes, frequently clean highly touched surfaces, and if you're sick, please stay at home. I really can't stress that enough. People who are ill should not go out unless they need emergency care. Please call for emergency care. We understand that you're worried and concerned. To help you sort out sort of a level of concern, the CDC launched this week a new self-checker program on their website that allows individuals to answer a few basic questions about their symptoms and then offers advice based on that. The tool provides information on how to care for yourself at home, or if you need to be referred to 911, it gives you that information as well. We will continue to share this tool via Allegheny alerts and our social media channels. It's also important to separate fact from fiction. Rumors can easily spread during times of crisis. To address this, we are launching by Monday a rumor control page on our county coronavirus webpage, so please visit that starting Monday. This is an unprecedented situation that we're all facing, and we need a total team effort and everyone to work together and to do their part. As a newcomer to county government, I have been so completely impressed with our county's effort and collaboration across all sectors, from the foundations, our private sectors, government, our hospital systems. It's really been an incredible example of collaboration. I want to say that we do all work together, and that's the way we're going to address this in our community. Chief Brown is here with us today to talk about all the efforts that are happening as part of emergency services, and his efforts are really commendable. So I welcome Chief Brown to talk to you next.
Thank you, Dr. Bogan. Appreciate the opportunity to speak with everyone today. Just to kind of highlight for you what our focus in Allegheny County Emergency Services is as we deal with this crisis. First of all, I want to thank the administration, Executive Fitzgerald, all the directors within county government have worked fantastic with us. As you may or may not know, one of the hats that I wear is the Emergency Management Coordinator for Allegheny County. So in addition to oversight of the 911 Operations Center, the Fire Marshal's Office, our Emergency Management Agency, and our Fire Training Academy, at times of crisis or disaster, as we're faced with right now, I am the face of the department for that and the primary coordinator as we make our efforts to move forward towards recovery. First off, I wanted to talk a little bit about 911, the fact that 911 is effectively working today, as it always has. One of the key points that we watch is to monitor that kind of volume of calls, and it's very similar to an average day, I'm happy to tell you. I'm forced to have to give a shout out absolutely to our 911 workers, as well as all of our first responders out there who are doing fantastic work every day. And through our emergency management structure, we will continue to support them and help to keep them safe. And I would ask the general public to do the same. So some of the tips that I think I might be able to provide in some of my description, you'll be able to provide that kind of help for our first responders and our 911 folks as well. From an emergency management standpoint, we effectively began what we call a level 3 emergency operations stand-up probably almost 4 weeks ago now. That began with an emergency support function, class 8, or number 8, which is really health and medical, and that group has been meeting for several weeks. That includes a lot of the major healthcare providers, as well as our Allegheny County Health Department representatives, our Allegheny County EMS Council partners, and many, many other entities as they began to roll out policies, procedures, guidance for the upcoming crisis that we could see. And that included some of the key elements, as the executive had mentioned to you, the PPE, personal protective equipment. So in that process, along with all that guidance, we also were able to begin some of our distributions of critical PPE to our first responders, and that started in the EMS field. And that was also in coordination with all of the other medical facilities that were included within that emergency support function, confirming that they were all in good shape and had no what we like to call unmet needs. That is really what we monitor day to day, hour to hour, in a coordinated effort across the wide spectrum of emergency management, confirming that no one has unmet needs. And where there are unmet needs, that we manage the need for that resource, and we have all of the avenues and contacts, not only to the voluntary organizations that the executive has mentioned, but certainly we can still procure materials, which we are still doing today. And we also have an avenue up to Pennsylvania Emergency Management, and then further even to the Federal Emergency Management Agency. And it is a well-crafted exercise, if you will, to be able to do that. Every level of our emergency management exercises with this. Many times, unfortunately, we need to actually activate and do these things in times of disaster. Certainly this crisis is very challenging, but we are operating within our lanes as we do for every disaster, and we are managing and functioning very well together. So I will tell you today, our structure, we're up to a level 2 emergency operations activation. We have tested ourselves with a virtual capability to continue to maintain those EOC operations around the clock. We meet physically, virtually, when possible. We minimize our staff that have to be together into a single room, and it's working very effectively. Right now, we have about 38 people represented within our emergency operations team with a constant line of communication with each other as we continue to evaluate what the resource needs are and what the upcoming challenges are. I would like to reiterate, one of our primary responsibilities, if you will, in addition to the obvious public safety and the greater good, is the protection of our first responders. We want to make sure that we are properly being the eyes and ears for them, that we're providing all the information, all of the resources that they need to continue to do the great job that they do, and to keep themselves and all of us as residents of the county safe. So again, I'm very appreciative of all the efforts. We've got fantastic partnerships. I say it every day in my line of work. I've been in emergency management for a very long time. I've traveled different sections of the world in an emergency management role. In Western PA, Allegheny County, Pittsburgh, absolutely is the most cooperative place that you could be on the planet, particularly when it comes to public safety. But as you can see in every element of what we do as a community, it's amazing how everybody comes together for the challenge. And we will meet this challenge, and we're in a well-coordinated mode to continue to meet the challenges as they come forward. So again, I thank you, and I can't stress enough to please follow the direction of the County Health Department. While I am the Emergency Management Coordinator and I oversee the coordination of those efforts, the Allegheny County Health Department is in the driver's seat. That's where we get our primary information from, and it also drives our primary needs and goals to move forward and support everybody. So again, just to reiterate, absolutely that information is just as valuable to myself as it is to you moving forward. Thank you. I'll turn it back over to Executive Fitzgerald.
Thank you, Chief.
And we'll take questions in just a minute, but I also wanted to just reiterate what Dr. Bogan and Chief Brown said. The level of support and cooperation from all sectors of this community has really been overwhelming. We live in a special place, we really do, and Pittsburghers have stepped up from folks in the neighborhoods to our community leaders, our corporate leaders, our universities, our foundation, the philanthropic community, et cetera, et cetera. It's really been an outpouring, and people have been very cooperative. People have been very good about staying away from certainly people with underlying health conditions, people of a certain age, seniors, and one of the reasons I wanted to give those numbers earlier is how serious it is for our senior population, because we know we have a significant senior population in this community, and how important it is for those of us who love our parents and grandparents to really make sure that we talk to them virtually through FaceTime and other Skype and other ways and communication without being physically near them. Let me give that website address once again, and then we're going to take some questions that I know the media has that Dr. Bogan and Chief Brown and myself will try to answer. But again, on the donations, and the outpouring has been tremendous, email us with any donations you might have to COVID, COVID 19 donations, DONATIONS, at AlleghenyCounty.us. Don't send anything yet. Let's coordinate it so we can make sure we're as efficient and streamlined as we can and get the materials, the PPEs and other things, as Chief Brown talked about, to our first responders, our medical professionals, etc. So with that, let me open it up to some questions that we might have. Amy, Ryan?
So our first question is from Marilyn Pitts of the Post-Gazette. Do Allegheny County officials plan to ask citizens to do anything else to stop the coronavirus from spreading besides what people have already been encouraged to do? Washing hands often, social distancing, working from home.
Well, and I'm going to ask Dr. Bogan I'm sorry. Okay, Dr. Bogan to say that, but obviously the governor has given an order that will be, I believe, start on Monday morning at 8 o'clock for businesses and other organizations that they have to follow. But let me ask Dr. Bogan to answer something on the medical front.
I think at the medical front right now, really the issues are to stay home, to call if you're sick and have questions, or to use that self-tracker, symptom tracker, checker. And I don't foresee anything immediately changing in the next few days other than the recommendations we've already given.
Our next question is from David.
Wait,
Kaplan.
Chief has something to add.
I'm sorry.
Chief Brown.
So I apologize, just to add to the further message. So I work and coordinate and help over 10,000 first responders within Allegheny County. We work with them, interact every day. This is one of them situations, one of these crises where I could officially tell you, every resident of Allegheny County, I need to be in my volunteer emergency management corps. And in doing that, when you're asking what you can do, you need to follow the guidance of the health department. It is for the greater good of yourself, but it also helps to lessen the burden to public safety, which is a key element to supporting you, to supporting the hospital systems, et cetera. So again, consider yourselves all emergency management folks at this point, and follow that lead from the health department.
Okay, so back to our next question from David Kaplan at WTAE. Do you all feel hampered by the 1955 law that prevents the state health department from releasing more information, even about the municipality where the resident lived? Is there a duty to let people know more?
Dr. Bogan,
No, I don't feel hampered by that. I don't think we feel hampered by that. The information has been shared that's appropriate. If we share neighborhoods, then people may get complacent in other neighborhoods and feel like they're not at risk because we've not been reported neighborhood by neighborhood. We also need to protect privacy of individuals. And so the importance is that if everybody, the only way to keep this virus from spreading widely is that everybody in our community does this, regardless of where cases have been reported or not. There may be more cases out there that we're not aware of. And again, you may get complacent if we say, well, this neighborhood has 10 cases and this neighborhood has none. You think, oh, well, my neighborhood's not affected, I don't go out. That's really not the message here. The message is we all need to do the same thing and stay social distancing and stay in our homes and stay safe.
This question is coming from multiple outlets, but could you please tell us where the investigation stands regarding the person who died and their contacts? And is there a point at which the health department would be overwhelmed by notifying the contacts of all the people who are being tested positive?
So I'm going to ask Dr. Brink to come in and address that. She's the head of our epidemiology department here and has been handling all of the tracking of our cases.
Sure. The very first minute we found out about that case, we began contact tracing of contacts of that individual. So we found out about the case, found out who all they'd been in close contact with within the 6 feet, and put all those individuals under quarantine. That is the same thing that we do with every subsequent case that we've had so far and will continue doing. At this time, we have modified operations in some aspects of the department to draw in additional individuals for that contact tracing. As you can imagine, that's become quite a bit more challenging over the past week.
This question is from Shelley Forts of WPXI. There's mixed information coming from officials in different levels of government. Who should we be listening to?
Well, when there's so many different levels of government, obviously we're hearing from the federal government and people like Dr. Fauci, hearing obviously from Secretary Levine at the State Department of Health and Dr. Bogan here locally. I think my sense is the message is very much similar. Different cities and different states might have different things that they've instituted, shelter in place at a couple different locations across the country. But my sense is that the message is very clear about health risk, contacts, things that we should be doing, how businesses should operate or not operate. And my sense is, while everything might not be 100%, it's pretty close. And the message is fairly clear across jurisdictions. And I think healthcare professionals are the people we should be listening to. We need to listen to the folks that do this for a living every day, that have dedicated their lives to medical needs, the needs of the community, healthcare needs of the community, and those are the folks I think we should all be listening to.
From Rosalind Colvin of the Incline, are you able to provide a breakdown of ages of the Allegheny County cases and tell us how many people are currently hospitalized?
Well, I'm gonna let them answer, but I'm not sure all of that data is actually compiled as of yet. And I think as Dr. Bogan said, sometimes that data is a couple days behind of where the testing is, where the results are, things like that. But I'm gonna ask now Dr. Brink if she wants to give us a little more detail.
Sure. We're not giving out a great deal of detail about the cases that we have under investigation at this time, but we can say that we have 4 hospitalized currently that we're aware of, that we've done the initial investigation on, and the most primarily affected are those in middle age. Of course, that's those of us who have been out in the community most, who are actively most exposed to other people in the community. So that's no surprise. It's the biggest age group.
A question from Paul Guff at the Pittsburgh Business Times. How was the level of participation in the governor and Allegheny County's requests and orders among businesses?
I don't know that we have specific numbers along those lines, but I think anecdotally what I have seen throughout this community is a tremendous level of support. There may be an outlier here and there who haven't taken this as seriously as we're trying to communicate that, but I think for the vast majority of the businesses, individuals, organizations, families are taking it seriously. And I think for the few folks that aren't, they're hearing from their friends and their family members to take it seriously. And that's, again, I'm going off of anecdotal as opposed to we have specific numbers on that. But my sense is this is one of those areas where Pittsburghers pull together and cooperate. Chief Brown mentioned the level that he's seen in the world he's been in the places he's been, and I think there's no question that Pittsburghers pull together, and in pulling together are following the advice of our medical professionals.
Sorry, the second question from David Kaplan. Dr. Bogan just said that we're seeing community spread. UPMC said we're not seeing it as badly as expected. How are our rates?
I think our rates are similar to other communities. We're, again, weeks behind places like Seattle and Philadelphia, but we're not that far behind. It's really hard to say. I think in some ways, I hate to speculate too much because we have limited data still. So I think our rates are comparable to others who were where we were a week or two ago.
question from Shirley Forrest of WPXI. Is there a expectation of when businesses might reopen?
No, there really isn't, and I think we're early on in this. We're really in our first week. I think from what I'm hearing from around the country, I think we are looking at least probably a couple of months, but I don't know that. I think, again, we have to see where this testing goes. And to follow up on the previous question and Dr. Bogan's point, you know, I think it was yesterday we went from 18 to 28 positive cases, and then from yesterday to today that we went from 28 to 31. Does that mean we're heading in the right direction? I don't know that we can even say that. It's only one day and it's a very small sample that we have. We may see some higher results in the days to come. So I think we need to remain vigilant. I think the longer and the better we are at mitigating this and lowering the curve, as we say, the better off we'll be, both obviously health-wise, but economically as well.
Jamie Martinez of the Trib is asking if the county is seeking specific donations through the email address, or it is a general email address for people who are willing to make donations wherever they may be going.
For now, I think this is really going to be on PPE, personal protective equipment. We know that a number of companies and organizations have N95 masks and other participants, but send those emails in, and we'll certainly take a look at it. There's other places where there's donations that are being collected. Our foundation community, through Hillman Foundation, the Heinz Endowments, the Pittsburgh Foundation, and R.K. Mellon and others are gathering materials, gathering financial donations, and will continue to do that. But the number that I gave out, the email address that I gave out earlier, was strictly to try to help to make sure that our first responders, our medical professionals, and others who are on the front line have some of the protection equipment that they need.
And finally, we have this question from a number of outlets. Is the county health department or other agency planning to challenge UPMC's decision to continue non-emergent surgeries?
We ask that UPMC, like all the other healthcare providers in our community, begin to address this request from the governor and from us to please wind down elective procedures as soon as possible. And I would refer you to UPMC for further comment.
And let me finally wrap up, and we'll certainly be giving out these through Allegheny alerts and the 11 o'clock announcement that the health department does every day. We're going to continue to communicate as much as we can. I can't tell you how grateful I am. I talked about the community. I also wanted to talk about some of the workers who are here working 7 days a week, working around the clock. Dr. Bogan and her team here at the health department, Chief Brown, our employees, the public employees who are out there on the front lines, are really stepping up and serving this community in ways that I don't think any of us could really appreciate as much as what they're doing. So I can't thank all of the folks out there enough for the great work that they're doing. We're all pulling together in this because we all want to make sure that our families are protected, our community is protected, our loved ones are protected, and working together, we're going to get through this. Thank you.
And finally, before we
yeah.
end, while we're not taking questions from Facebook Live, we have multiple people asking you to repeat the information relative to the individual who has unfortunately passed away in Allegheny County.
I'm sorry.
Just the person next to Steve.
Yeah, there was a person who had unfortunately passed away. Our first fatality for COVID-19, an individual in their late 60s who had been hospitalized in acute care. And again, we want to give our sympathies and our condolences to the family and the loved ones of this individual.